Hello and welcome to this video presentation. I'm Maria Alexandrou, a local counsellor in Enfield, North London, and one of the organisers for the Cervical Cancer Awareness Conference, which was held during Cervical Cancer Awareness Week. All the presentations were full of important information, support and advice about cervical cancer, so we have now made them available on several standalone videos. Here we have the presentation from that conference by Dr Nitu, who's a senior consultant gynaecologist based in London. Nitu spoke about cervical itself, what it is and how it can be transmitted. So let's hear what she has to say.
I've been a consultant gynecologist for about 20 years, a little bit longer, and I'm based at Barnet and been a gynecologist and an obstetrician for over 35 years. So I have lots of information on my website that people may find, and this particular presentation with all the slides will go onto my website within the next few days. So you don't have to take notes, and my website also has lots of fact sheets, so you can just listen and actually try and engage and ask questions. So today we'll be talking, or I will be talking, on what causes cervical cancer, what the risk factors are, I will try and weave in a few case stories. I must remember to talk about the diethylstilbestrol as well, although it's rare, preventing cervical cancer, and with the help of vaccines and cervical screening, and actually understanding what cancer means. What is cervical cancer? What signs should I be looking out for? And I will be very brief on treatment, but we'll be talking more about the more common things that women may find. I'm also a trained colposcopist as well as a trainer, which means I have specialized clinics where I do colposcopy clinics looking at women with precancer, as well as vulval clinics, because I have a special interest in complex vulval problems. And finally, talking a little bit about lifestyle. So I want you to remember a few things as we go along with this whole presentation. Remember that cervical cancer is the most common cancer in women under the age of 35. I want you to remember that. I also want you to remember that 99.8%, which means almost 100% of cervical cancer cases in the UK are preventable. And this is really important because this then informs us as to why cervical screening is so important and all the other measures. So you might know that 1 in 7 women in the UK will have a lifetime risk of breast cancer, while 1 in 142 women will have a lifetime risk of cervical cancer. But what makes cervical cancer so different is that it is caused by an infection. And because of this, we are able to prevent this by diagnosing it early. And so because we can visualize the cervix, because we can sample the cervix, this is what makes it so unique without actually being too invasive. And since the early 70s, the cancer rates have actually reduced by over 3/4 and by another 21% in the last 10 years. And we think with the introduction of HPV vaccine, the projections are that we're going to find that these levels will fall even further. And this is not just one thing, it's a combination. It's about spreading awareness and education with the HPV vaccine, cervical screening, and as a result of that, early diagnosis and treating early. So we're going to try and touch on all these various aspects. But before I do that, I just want to draw your attention to a survey that was just recently. This was in November. And it's quite worrying that 1 in 4 women don't know where their vagina is. Less than 1 in 2 women will know where their cervix is. And 1 in 10 could not identify a woman's reproductive system. So the question is, whose role is it to educate? Is it the parents? Is it the school? Is it governments? Is it healthcare professionals? I would say it's each and every person. There should be no contact point that should be missed where we are not educating people to destigmatize, the female reproductive system, be able to talk about words. Often you'll find on social media, words like vagina or sex are actually then get blacklisted. So you can't actually talk about it. And so it's really important that we learn to spread awareness by talking about these things and busting myths and reducing misinformation. So before I start talking about cervical cancer, I think we, as women and men, should know different parts of our body. And so here you can see that this is the outside before, and often gynecologists as well as GPs and healthcare professionals will often miss problems in this area because we've been taught to go straight in and look at the cervix. But there's a lot happening here as well. So it's really important to know where one's clitoris is, the lips, the inner and outer lips of the labia, as well as this entire area is known as the vulva. From the top of the mound right to the back passage, the top of the back passage, this area is known as the vulva. That then leads into the vagina. And then you have the cervix, which you can see over here. And it looks different in different women, especially if you've had children, if you've had surgery to your cervix. And this then leads into the body of the uterus, where one has the lining, which gets shed every month for a period and holds babies, as well as the fallopian tubes and the egg-containing baskets, the ovaries. So it's really important to know your body, because if you don't know the different parts, you don't know when something is wrong, how to express it, and you may not then get the right attention. So this is a close-up of the cervix, and this is somebody who would not have had a baby usually, or had a cesarean section before she's dilated. So you can see the uterus, the fallopian tubes, the ovaries, and the cervix, and this is the vagina. So what causes cervical cancer? So once you know the different parts of your body, you have to understand that almost 100% of cervical cancer cases are caused by infections, of which 99.7% are actually caused by the human papilloma virus. There's a small percentage where, herpes and HIV have been implicated, but basically, if one has cervical cancer or cervical abnormalities on the smear test, it is because of a virus infection. And this is only obtained through sexual contact. It's the major cause. It's very common. 8 to 9 men and women in their lifetime will get an infection with human papilloma virus. Most of us will clear it within a couple of years, but some people, it will hang in there and cause changes. So the human papilloma virus is the virus that is responsible for causing cervical cancer. Now, a few facts are important. So most people will suffer no ill effects from getting this infection. There are over 100 different strains, and 40 of them affect the the back passage area, as well as the female and male reproductive system. And the way we actually divide these different strains are as to whether they have a potential of causing cancers. And so that is, those are known as high risk. Having said that, most people, even with high risk strains, will clear it naturally. But there are a few, like 16 and 18, that cause about 70% of cervical cancers, while the lower risk numbers are implicated in genital warts. As of now, we don't have testing for men, and we also don't have any program where we actually we test women who have female partners. So there is no testing available for men, but men can also get HPV infection, and if it persists, especially if they are smokers and if they drink alcohol in excess, they're at a higher risk of getting oropharyngeal or oral and throat cancers, as well as penis cancers. So human papilloma virus is what is the cause of cervical cancer. That is the important message I want you to remember. I also want you to remember that cervical cancers are all preventable, pretty much 100%. So most people will get it in their lives, majority will clear it on their own, and one does not need to have penetrative sex with a penis to actually get human papilloma virus, although that is usually the most common way. One can get it from the first time of being sexually active if you have been in contact with somebody who has been in contact with one other person who is carrying the virus. That's how you can get it. So obviously, the more partners one has and the earlier one starts having sexual contact, the higher is the risk of getting the virus. So one can get human papilloma virus from any skin-to-skin contact of the genital area, and whether it's vaginal or anal or oral sex, or from sharing sex toys. So We know that the virus causes cervical cancer. We know most of them are preventable. We know it's the most common cancer under the age of 35. But what are the risk factors? Having a risk factor doesn't necessarily mean that you're going to get cervical cancer. In fact, most people won't. But HPV infection is a necessary base. And we know that over half the cases are diagnosed under the age of 45. So it's a young people's cancer, although it kills more people after the age of 75. Tobacco smoking, the earlier you start smoking, the more you smoke, then cervical cancer has been implicated in as many as 21% of cases. Having children, again, exposes you more to more sexual intercourse, so more HPV, especially at a younger age, multiple partners, having sex at an early age, previous cancer from any site, your back passage, vulva, vagina, urinary tract, kidney cancer, all these will increase one's risk of cervical cancer. A family history of cervical cancer, if you have a mother or a sister or an aunt, HIV or you can increase it also through a similar mechanism of weakened immune system, although women who have autoimmune conditions can find it difficult to clear HPV. And sexually transmitted infections like chlamydia and gonorrhea also increase the risk in the presence of human papilloma virus. And there is some discussion which we need to have about the contraceptive pill, which is a lifesaver for most people, but it's important to know a couple of things because your patients may ask you this, for health professionals who are on the site. So doctor, I've been on the pill for almost 10 years. I've read that being on it for years can increase my cervical cancer risk. Should I stop taking it? Well, the short answer is generally no, unless you can afford to get pregnant or unless you have an equally effective form of contraception that you're willing to consider. So it's important to know that the combined pill is not associated with an overall risk of cancer. And in fact, if you take it for at least 4 years in your lifetime, it halves the risk of ovarian cancer, which is very difficult to predict, endometrial or womb cancer, and colon cancer compared to those who haven't taken the pill. But if you take the pill for more than 5 years, there is a slight increased risk of cervical cancer. And we don't know whether it's because of the pill or whether it is because of sexual behavior increasing the risk of HPV. But what is the good news is that within 10 years of stopping the pill, your risk goes back to being that of a non-user, which is different from ovarian and endometrial protection, which lasts lifelong even after you stop the pill. So benefits outweigh the risks. So you don't have to rush getting off the pill, but you do need to have a discussion with your GP or specialist so that you can discuss whether there are other options available that are safe for you, because an unwanted pregnancy is definitely more risky than the small risk of cervical cancer. But we would advise that you should consider the HPV vaccine and keep up with your smear tests. So how do we prevent cervical cancer? Now, to prevent it, you have to start with education. So knowing where your cervix is, knowing your body, having these discussions right from young age in schools, with parents, with health professionals. Don't miss a single opportunity to educate men and women, because nobody really knows your body better than you do. So sexual health education and cervical cancer awareness, like these programs, is really important, but lifestyle measures are also important. So trying to ensure that you try and wait or encourage your patients or your children to wait before they have intercourse at a very young age. Avoiding smoking and alcohol, as there are no safe limits, and not just we don't advise not having sex, but you need to have safer sex. You need to make sure that you use condoms and dental dams for every sexual encounter, and consider having the HPV vaccine if you're suitable and if you're offered, because I'll go into that, and regular cervical screening. It's all these measures that will help to take the diagnosis down of cervical cancer and the death rates down. So lifestyle measures, health education, and safer sex, vaccination, and screening. Francis, am I doing okay for time?
Yeah, I think so.
Okay. So the HPV virus vaccine, the one that we offer on the NHS, protects you against 4 of the viruses. And if you remember 16 and 18 strains, those 2 strains were the ones that caused 70% of cervical cancers. So it's really important that those are covered. 6 and 11 will protect against genital warts, and both men, boys and girls, and people of anybody with a cervix really should consider the HPV vaccine, but boys are also being offered from last year. The vaccine does not contain any cancerous material, any infectious material. It is absolutely safe. And the vaccine protects against not just cervical cancer, but also head and neck cancers, anal cancers, and genital warts, and vulval and vaginal cancers. And it's free on the NHS from the age of 12, 13 up until your 25th birthday. But we would advise you to have a discussion with your doctor, because you are eligible to, you should consider having it in certain situations until the age of 50, even if you've been tested positive with HPV virus before. And the one that's available privately has 9 strains that it covers rather than 4. In England, girls and boys are offered from the age of 12 to 13. And it's so important to complete the course to get the proper immunity. And that can be, the second dose is between 6 to 12 months usually. And after the age of 15, we would recommend 3 doses. And men who have sex with men and some transgender people can also have the HPV vaccine free on the NHS. And Claire, Dr. Stevens has already spoken to us about the cervical screening frequency. And it's important to know that most people who get infected with HPV would have cleared it by 25, which is why we start at 25. And most people will actually be better, and you create less anxiety by starting at 25 and finishing around 64. And there's a small group that needed continued afterwards. So what we actually do is we don't really test for cancer. What we're testing is, first of all, we're doing what is known as a primary HPV testing. We're testing to see, are you positive to high-risk HPV strains? If you are, we then go in and look at the smear test to see whether there are cells that can be identified, so we can actually manage and observe you and treat you if needed. So smear tests are not for diagnosing cancer. But what is really worrying is only 70% of eligible people in the UK are attending cervical screening, and Central London has the lowest rates. And Enfield also doesn't have the best rates, and our target is about 80%. And the biggest group that actually need it are missing out. So it's the under 50s, especially 25 to 29. And often there's a misconception, there are smear fears, and we know that particularly Black and minority communities, which Christine Ekechi will be talking about, has a low uptake. So, and Joe's Cervical Cancer Trust does a lot of good work. So it's really important as healthcare professionals that we use inclusive language. And so everybody who has a cervix is eligible to have cervical screening, and also to use different languages, because language barrier can be a real problem. And so Public Health England has got downloadable leaflets in Urdu, in Bengali, in Arabic, in Chinese, in 10 different languages. And when and I often see women and people with learning difficulties. And so you do have to find out first, is the screening definitely indicated? Have they ever had any sexual contact? You need to be aware of the different ways to reduce stress. So you may use books, leaflets, videos. Take your time. They may need to visit the clinic a few times before you can actually get them to trust you. They need to have somebody with you. So it's really important to think about these things at every stage, and to ask for this and be a champion for these people. And so one of the things I like to talk a lot about is ending smear fear, because every time I see girls in my colposcopy clinic, they usually say that they were scared, or they had a bad experience, or they weren't, they didn't know what was actually going to happen. So go with a friend if possible. I know it's harder with the COVID situation. Read a reliable leaflet, practice some deep breathing techniques. If you're having a normal period, reschedule it, but don't repeatedly cancel, especially if you're having irregular bleeding, because that may be a sign of cervical cancer or other problems. Take some painkillers, ask the right questions. Ask for sexually transmitted infection tests if you need them. Don't ignore that, and mention any other worries that you may have, because that can then trigger an appointment at a later time for you. And if you're worried, if you found that the speculum has been particularly painful, I always ask the patient, would you prefer me to use a smaller speculum? And that's important, especially women who have not had children. You want to use a small speculum rather than putting a really big instrument in. Get them to listen to music, try to rest your bottom. You may be asked all these things, and I advise my healthcare professional colleagues, don't rush the appointment. Take your time, because sometimes people are really scared and you need to take that time. The majority of people are fine, but when you discover that somebody is anxious, take your time. Ask them to wait if you're worried about running late. people won't mind that, but just being kind and actually reassuring does help a lot.
Well, I hope you found that both helpful and informative. This is one of a number of other videos from that conference. If you want further information or have any questions, then please contact us. The email address will be at the end of the programme. Thank you.